Mr. President, I asked to speak before the Senate for about 10 minutes.
Without objection.
Thank you, Mr. President. And I rise today to urge my colleagues to oppose the blunt amendment, which could lead to devastating health outcomes for over 20 million women across our country. Just 2 weeks ago, I applauded the Obama administration's decision to require health insurance plans to provide coverage of FDA-approved contraception needed for women's health care without co-pays beginning this August. The final rule issued by the Department of Health and Human Services was a tremendous step toward improving the health of our nation's women and their families, a step that was long overdue and one made with due respect for all Americans' religious freedom. Tomorrow, we will be voting on an amendment that would not only undo that progress, it would move us backwards. What is especially frightening is that this amendment goes much farther than just reversing the rule, because it is not limited to religiously affiliated entities. The proposal would allow any employer or health plan issuer to refuse coverage of any service for any reason, not just religious objections. If an employer had any moral objection, it would be permitted to refuse coverage for critical care such as alcohol and other substance abuse counseling, prenatal care for single women, and mental health care too. The way this measure is worded, employers could deny screening and treatment for cervical cancer because it is linked to HPV, or refuse HIV/AIDS testing and treatment due to an objection to ways the viruses can be transmitted. They could even refuse to cover certain FDA-approved drugs and treatments because they object to the research that led to the drug's development. Major national pediatric organizations recently voiced their concern that if this amendment becomes law, an employer who says they object to childhood vaccines on the basis of personal beliefs could refuse to cover these life-saving and otherwise costly medical services. In short, this amendment allows corporations nationwide to overrule the religious and ethical decisions made by the people they employ and to trump the health care advice of their doctors. If this amendment passes, it will discriminate against most of those who need financial support. That is not right. All Americans deserve access to health care. We cannot allow partisan ideology to hurt the health of our women and children. If we do, our sisters, daughters, and granddaughters will pay the price. If we defeat this amendment, the final rule will save most American women who use contraceptives hundreds of dollars each year in health care costs. Health experts agree that birth control helps to save lives, prevent unintended pregnancies, improve outcomes for children, and reduce the incidence of abortion. Another point raised by my colleagues, Senators Gillibrand and Boxer, and I thank them for promoting awareness on this issue, is that 14% of women who use birth control pills, and that is 1.5 million American women, use them to treat serious medical conditions. Some of these conditions include endometriosis, ovarian cysts, debilitating monthly pain, and irregular cycles. Religious principles are deeply important to me as a Christian, so I am glad that the current rule accommodates conscientious objections and exempting religiously affiliated organizations from both offering and paying for birth control coverage for their employees. At the same time, the core principle of ensuring all women's access to fundamental preventive health care remains protected because the care will be offered directly by the insurance companies. To deny any women access to affordable health care, as this amendment would do, is unconscionable. It could have devastating effects not only on her health, but her families as well. In speaking with women's health advocates and providers in Hawaii and across the country, one of the most common recommendations I hear for improving women's health outcomes is to ensure access to effective contraception. Across the state of Hawaii, about 150,000 women seek access to birth control every year, and almost half of them depend on financial assistance to obtain it. Right now, women in states that do not have plans that cover birth control face costs of around $600 per year. Women and families who cannot afford it can end up facing tens of thousands of dollars in costs arising from complications from unintended pregnancies and other health care problems, costs that taxpayers often end up supporting. With these facts in mind, I am not surprised that a survey has shown that 71% of American voters, including 77% of Catholic women voters, support the administration's requirement to make birth control available to all women. I firmly believe that religious liberty is protected under the new rule, while access to this preventative care does not discriminate against anyone, no matter who they work for or what their occupation is. I urge my colleagues to join me in voting against this dangerous amendment, which would set back improvements in preventative services and women's health care in this country.